to use. And we mentioned that there are types. The type 1, which is basically the lack of insulin. So the body don't produce enough insulin. Insulin is like the vehicle that transports glucose from your blood into the cells. So if the vehicle is not there, the sugar will be stuck in the blood. And there is the type 2. The type 2, the insulin is there, but then the sensitivity of the insulin has gone down. So the cells don't recognize the insulin. So it can transport the glucose from your blood into the cells, but when it gets to the entrance of the cell, it's not able to open up. There are certain receptors on the cells that allows the insulin to enter. But when there is insulin insensitivity, when the insulin gets there with the glucose, it's not able to open up for the glucose to enter the cells. So in that way, still glucose will be packed in your blood. And also there is the gestational diabetes, and that one has to do with pregnancy. So it happens mostly during pregnancy. I mentioned earlier that insulin is a hormone. Yeah. So it being a hormone, when you are pregnant, there are some people that don't have control of over the production of hormones and other things when they are pregnant. So some people experience hormonal imbalances, and sometimes it can affect the insulin, because insulin is also an hormone. So if it happens that way, then it means that during your period of pregnancy, you have high sugar levels, but mostly after childbirth, the sugar levels becomes okay. But there are people that can progress to type 2 diabetes. So the gestational diabetes mostly can progress to the type 2 diabetes. Yes. So if you have gestational diabetes, you need to manage it. Even after childbirth, you need to be monitoring it. Naturally, after childbirth, it drops, but you need to monitor it, because we have a lot of people who come to the hospital with gestational diabetes, but now has a full-blown diabetes because they were not paying attention to it. So they will come and their sugar levels are rocket high. So we need to be monitoring it even after childbirth to make sure that it doesn't go overboard.
Like how long after childbirth? Like a year or 6 months?
You need to be right after childbirth. It starts going down.
Okay.
So when it goes down, you'll be off medication. You wouldn't be on any medication, but then every 3 months you need to check. Your next pregnancy is likely to come again. So
because now you know your system, you know what to look out for and everything.
After you've finished giving birth, mostly it happens after they finish giving birth. Like you want to have 3 children, you've had all the 3 children, so you think you are off the hook. But then when after that, the sugar can still keep increasing, so you need to be monitoring it from time to time to make sure that it doesn't go overboard. And we also looked at certain the symptoms.
And
I mentioned that mostly you don't see the symptoms, but when you are fortunate to see the symptoms, these are some of the things that you see. The frequent urination, that is one of the major symptoms that people see, because when you have diabetes and glucose is not entering the cells, it means that your body, there will be so much sugar in your blood. Yes, and there is a system that sort of absorbs water into your system, so it causes you to drink more water. So there is that increase in thirst, and once you are drinking so much water, you'll be also passing out a lot of water. And also you'll be eating a lot, but then you'll be losing weight.
That part I still can't wrap my mind around.
Because you are not making good use of
you can't get enough energy as well.
Yes. I mentioned last week that diabetes is a metabolic condition, and it has to do with how your body metabolizes the food that you've eaten. So anytime you eat food, it has to be digested, and it turns into nutrients that the body needs. So if the glucose part of the nutrient is not well absorbed, that is what causes diabetes. So though you are eating, but then the glucose that is supposed to give you energy is not finding its way into your cells. So then your body will feel as if you are not eating. So it will cause you to eat more. The hunger trigger will increase, and you eat more. But then the more you are eating, you are still not getting the energy required. So, and in the body too, once the body is not getting the glucose that it needs from the food, it falls on the next source of energy, which is the fats. So the fat that I've stored in your body will start to break down.
You start losing weight. Despite the fact that you are
eating more, you start losing weight because the fat is being broken down. So apart from the frequent urination and the weight loss too.
The drinking lots more water as well.
So there is easily fatigability because you are not getting the glucose. It's as if you've not eaten because there is no energy in your body, so you easily get tired. The listing, some people may even faint and all that. Yeah, so it can get to that level. Yeah. So basically, these are some of the things that we touched on last week. Yeah.
So that was a recap of what the conversation we had last week. If you have any questions or things you're not clear about, you can send us a WhatsApp message on our line 055-556-1034, 055-556-1034. Dr. Prince, how major a role do genetics play when it comes to diabetes?
Yeah, it's one of the risk factors. So, apart from the genetics, aging is another thing. So, when you are aging too, it can also increase your risk. But when a member of your family has it, let's say your mom, your dad, the immediate family members, when they have it, the likelihood of you having it is quite high. So, it has to do with how your body metabolizes things, as I mentioned earlier. And metabolism has to do with your genetic makeup. So if you have a good metabolism or your parent had a good metabolism, you are likely to also have a good metabolism. But if it's the opposite, then the likelihood of you also having a bad metabolism is high. So if your parent had diabetes, you are at risk of getting it. You may also get it. But there are certain things that could push your chances of getting it later. So you check your dieting, you exercise and all those things, it could push it back. But then people also think that because it's not in my family, I wouldn't be able to get it. You can still get it even though it's not in the family. You can be the origin of it. Yes. So,
and we don't want that. We don't want that.
Yes. So people say that, my parent never had diabetes, so I can eat whatever I want.
And they took all the sugar and stuff.
Yes, then they were okay.
Everything, and they were fine.
But you may have it, so you need to, as much as possible, reduce the intake of sugar. And I mentioned last week that it's not just the sugar. It's not just the white sugar that could cause diabetes. The food that we eat, the carbohydrate diets and all those things could also increase your risk. So it's not just about eating white sugar. People come to the hospital, you diagnose diabetes and they are like, oh, I don't even eat sugar. So these white rice that we eat, the starchy foods, the yams, the fufu, the bangkung, almost all the diets in Ghana are carbohydrates.
I remember you saying how we like to eat heavy
You see.
and we are not happy, but we'll try and moderate it.
And the heavy food too is eaten in the evening. Funny enough, we eat heavy in the evening, but it shouldn't be that way. We need the energy for the day. So you are in the day, you are working, you need that energy. In the evening, you are basically going to sleep, so you don't have to eat so much. You eat something light in the evening for bed, but then during the day that you need the energy, that is when you can eat some of these food to burn the energy. And you see that most in the work that we do now is more of sedentary work. We don't really engage in physical activities and all that. So you have most of us in the offices fighting in the queue with the wachi and all that. We don't really need that.
We don't even go and buy the wachi. You let somebody else bring it to you. And you sit down.
You sit down in the air condition. You eat a whole pack of wachi, and you don't really do much with wachi. We are always in our chair. When you need something, you just push the chair. You don't.
If you have the rollers like this one, you just
slide it and get it. But we need to be walking around. We need to burn the food that we're eating, because if the energy is there and you are not burning it, it stores in your body, and later on it will get to a point that the body wouldn't be able to store it again. Then it will be packed in your blood. Then it can increase your blood level, your sugar level.
Before we go to the complications, earlier you mentioned the fact that one of the symptoms to look out for is, like, aside the frequent urination, when you start drinking a lot more water. But some people are also of the opinion that for those who don't have the condition, it's like, can water help in controlling your blood sugar?
Not necessarily. People have the notion that, as we mentioned, that you don't have to take more sugar. People dilute whatever they are taking. So let's say if you are taking a cup of tea and you added a cube of sugar to it, and you diluted it to the extent that you can't really taste the sugar, and someone ate just the raw sugar like that, it's the same thing. The concentration is the same. You took the same amount of sugar.
Now that you say it, I think about it and I realize, So we are not fooling anybody.
So people may dilute their drink and I know people take some of these fizzy drinks because they are not supposed to take so much sugar. They dilute it so that it wouldn't taste that sweet in their mouth. But if you're able to take the whole bottle of the fizzy drink,
it's the same
thing. Yes, someone who took it without diluting it is the same thing.
Wow.
Yeah, so you don't really have to sort of dilute what you are taking. It's the amount of sugar that has to be reduced, not you diluting it to the extent that it wouldn't taste sweet.
Oh, but doc, hold on. Wait, what if you dilute it? You don't drink it all at the same time? Because sometimes when you don't dilute it, you can drink it at a certain. Perhaps what if you take it during at certain parts of the day? You don't take it all at the same time.
If I took all today, if I took mine just this morning,
yes,
and you took it throughout the day,
yes,
it's almost the same thing because it's the same concentration of sugar for the day. So it's what your body can take within the day. That is what matters. It's not about you taking it in short intervals and diluting it.
My goodness me.
You're a victim, right?
Oh, I'm just thinking of those who do it. But, so now we come to what happens when you get a diagnosis and you don't treat.
Yes.
You don't treat it. What are some of the complications that can result?
Okay, so there is a short-term complication and there's the long-term.
Okay.
With the short-term, you can either have what we call hyperglycemia.
Okay.
Or hypoglycemia.
Okay.
Yeah, so the hyperglycemia, hyper means high.
Okay.
So the sugar level can go so high to the extent that it can cause certain complications. There are people who have high blood levels, but then it's not causing any symptoms or any complications in their system. So the hyperglycemia is just that the sugar level has gone so high. Okay. Mostly in the clinical settings, if you come to the hospital and your glucose level is more than 18 millimole per liter, we say that you have hyperglycemia.
Okay.
Normally, it shouldn't be more, if you've not eaten, it shouldn't be more than 7.
Oh, wow.
Some books say that 6.3, yeah, but it shouldn't be more than 7. But if yours goes as high as 18, ideally you need to be admitted so that you can be monitored to bring down the sugar level, because before you can be discharged. People come and when you want to discharge them, it becomes a whole wahala, because once it's high, there is the likelihood of you fainting. There is the likelihood of you going off at any moment in time. Yeah, so we need to monitor it in that way. And the opposite too is not good when it goes so low. Yeah. So the hypoglycemia too is not good. So people, especially those with diabetes, when they are on the medication, sometimes the medication can cause you to go into hypo, or your blood level can go so low. Yeah. Yes. And the lowest that the limit that it should be is it shouldn't be less than 3.3. So when yours goes below 3.3, then we say that you have hypoglycemia. So managing diabetes is quite complicated, because you don't need it to go so high, you don't need to go so low. Yes, so you need to be within the range. Yeah. The normal range is between 3.3 to 6.3, or in certain books 7. Yes, so if you go more than that, then there could be some of these complications. And also we can have what we call diabetic ketoacidosis. So with diabetic ketoacidosis. Okay. Yes. Okay. So I mentioned earlier that one of the signs that, or the symptoms that you see, is you are eating a lot, but you are losing weight. Yes. The weight you are losing is because your body is falling on your fats. And when fat breaks down, it leaves these ketone bodies in your body, your system and all that. So when these ketones accumulate in the body, it can cross to the brain. So it can cause confusion. It can cause, you can go off. There's fainting and all those things. And sometimes people start to, there's this fruity smell when sugar goes high so much, and there is that ketoacidosis. You start having this fruity smell from your breath and all those things. So from those, we can diagnose the diabetic ketoacidosis in that way. But they are all the short-term complications, but they are the long. These are just the short-term. Yeah, these are the short-term complications. Wow. Yeah, these ones, when we pick it up early, we can manage you for you to be okay. So for the hyperglycemia, if it goes high and we see it early, we are able to give medications to bring it down. Will it go away after managing, or no? That is when it's, when people don't know they have diabetes and they are eating all sort of things, and sometimes they go off and they come to the hospital and you check, you see that the sugar is very high because they were not aware, so they were eating everything. So that is when most people are diagnosed. So at that point, when we give the medication for you to be normal, then we start to put you on oral medications for you to be okay. So that is the point that we diagnose that you have diabetes. Yeah, but it doesn't go completely. We manage it to the extent extent that you'll be able to live with it without causing any further complications. Because when it keeps going on like that, it can cause certain, that is where it can lead to the long-term complications that I want to mention about. So with the long-term complications, we can have cardiovascular diseases. Funny enough, hypertension and diabetes, they move hand in hand.
Because when you mentioned the hyperglycemia, I was like, it sounds so much like hypertension. Like because of the high, you know, at the beginning.
Yeah, so if you have diabetes and you don't manage it well, the likelihood of you tripping into hypertension is very high. So people with high blood pressure sometimes can get diabetes, and people with diabetes too can get high blood pressure. So they are like sisters. So when one is coming, you need to monitor the other. That's why when you come to the hospital and we are managing you, even for hypertension, we sort of check your blood sugar from time to time to make sure that it doesn't go high. When we are managing you for diabetes too, we have to be checking your blood pressure from time to time so that it doesn't go high, because the two of them can go hand in hand. Apart from that, we have what we call nephropathy. So we can have, nephro has to do with the kidneys. Yes, so most of the kidney conditions that we have has to do with diabetes. If it's not well managed, it can cause kidney failure. Yeah, so if the sugar levels are so high, you know that the kidney is what takes away waste products from the body. Ideally, you don't have to see sugar or glucose in your urine. The kidney has to deal with it. So if there is so much sugar in your blood system, then it means that some of them will get its way through the kidneys and it will come into your urine. So when you start seeing glucose in your urine, then it means that the kidney could be failing. It might not be doing its works as it should. So a long-term effect of diabetes could lead to kidney failure. Yeah, so that is one of the things that we have.
Will your urine change color when that happens?
No, when there is glucose in the urine, it wouldn't necessarily change color. You are seeing a change in color because probably you are not hydrating a lot. Most of the color change in the urine has to do with hydration. If you don't drink enough water, and certain infections too can cause the color changes in the urine. But with urine glucose, you are not seeing any change in the color. It's just that we need to check to make sure that the glucose in the urine is optimal. Ideally, you don't have to see but the people come to the hospital, you see traces of it. There are some people that you see 1 or 2 pluses in it, depending on the severity of the condition. Yeah, and last week I mentioned that some people, after they urinate, there is ants all around it. When there is glucose in your urine, that is where you see some of these things. Time back, people used to taste the urine to check if they have diabetes. But now there are tests that is not expensive. You can walk into most of the pharmacies around, even check for the blood glucose, and you can also go to the hospital to get it checked if there is any changes in it. Apart from you having the kidney condition, you can also have a neuropathic condition. So your nerves, the nerve system could be affected. So we have what we call the diabetic neuropathy. So sometimes it can affect the nerves. People with diabetes complains that when it will get to the point that even when they are wearing slippers and it goes off, they can't feel that the slippers has gone off because there is no sensation within the legs. Some people may get a wound. I mentioned sometime that it's the nerves that makes you feel sensation. So if there is a problem with the nerves, then it means that even if something happens to your body, you may not feel that sensation.
So you may be bleeding and you won't be aware.
You wouldn't. Yes, you may have a cut on your leg. You wouldn't know that there is any sore. So if you've noticed, most diabetic have what we call diabetic foot ulcer. Yeah, so they get sore on their legs because they don't know that there is any sore there. They wouldn't dress it. They wouldn't pay particular attention to it, and the sore will keep increasing. So it can increase to the extent that it can become so big and the healing becomes an issue. Also, when you have glucose in your blood, healing of wounds become an issue because the bacteria and other things that are supposed to help with the wound healing is affected when there is this glucose in your system. So some of these things could affect your nerves. The diabetes can affect the nerves and it can lead to some of these things. You can also have what we call retinopathy. It has to do with the eye. So people with high blood glucose sometimes experience blurred vision. So you see that all of a sudden you see some blurriness. When you look at something from a far distance, you wouldn't be able to see it well. Those people may go to the eye clinic, but when you go and your blood sugar is high, you'll be asked to control the sugar before you come back. There are some cases that people have issues with the lenses of the eye and all that. So that could also cause blur vision. But if the lenses are okay, but still you start having some of these blur vision, it could be a sign that you are having diabetes and it's affecting the eye, because the blood vessels of the eye are so thin to the extent that if the blood glucose increases there, it wouldn't be able to help the lens to focus well. So you start having some of these symptoms with your vision. And
so even though you have something to help you with your sight, it's still not
it's still not working effectively. Well, yeah. So if all of a sudden you start having some of these things, you should know that probably your sugar levels might be high, or maybe you have the diabetes, but you are not really paying particular attention to it. Some people take medications, and when they check and it's normal, they feel that the condition is gone.
Yeah.
And those people
they may go back to their old habits. You know?
Yes, and these people will come to the hospital with some of these complications because you feel that the symptoms are not there, so you are okay. As I mentioned, people can have the diabetes but may not show any symptoms. So if you are not showing any symptoms, it doesn't mean that the condition is gone. It could mean that it's somewhere and it's causing some organ damage within your system. As I mentioned, it can affect the kidneys, it can affect your nerves, your ability to feel sensation and all that. It can affect the eye. It's affecting your nerves can also cause erectile dysfunction in men. Yeah, so men with high glucose level could have erectile dysfunction. So the manhood has to do with the nerves and the blood vessels and all that. So if the nerves are affected, it means that your libido, your sensation and all those things will be affected. Even in women, most women have low libido because of diabetes. Yeah, and recurrent infections. So when there's so much sugar in your system, it means that you'll be prone to infection. Your immune system will go down. Mostly with diabetics, their immune system go down. So the least thing that affects your body could cause infection in you, especially the women. They come to the hospital with recurrent yeast infections, that's the candida, and other forms of bacterial infections within the genitalia. So if you're having infection, you treat it, it goes, it comes, it goes, it comes. You should also check your sugar.
For that,
It's funny enough how our grandparents used to tell us that if you are a woman and you eat so much sugar, you get to the so it has that link. Yes, so if you consume so much sugar, there is the likelihood of you having diabetes, and when you have the diabetes, it can lead to some of these recurrent infections. So these are some of the complications. It can, in some people, it can cause cognitive issues, so they easily forget things. Some people may have hearing loss, some people may have skin infections, because as I mentioned,
all starting from diabetes.
Yes, all from diabetes. As I mentioned, once the immune system is low, the least thing can cause some certain form of infections in your system.
With the retinopathy and neuropathy and everything you mentioned, where it affects the eyes, the sores on the legs, the thing. Does that mean if things are not checked, you may lose your eyes, you can lose your legs?
Yes. People can go blind from diabetes. So if it's not checked and it keeps increasing, then it means that you may lose the ability to focus, because the eye, there are lenses. Just like the cameras, we have the lens, you can zoom and all those things. The eye has that. When you are in a brighter place, it opens up. When you are in a dark place, in that way, it allows certain light to enter. That is what helps you to see. So that ability for the lens to move and all that has to do with the cells within the eye needs the blood supply and all that. So if it's not getting enough blood supply, it means that those cells within the eye could die, and the eye may lose that ability. With the cognitive abilities that I mentioned, the brain needs blood. So if the blood is packed with glucose, it means that it wouldn't be able to flow well within the brain, and it can cause some of these cognitive issues that we mentioned. With the foot, once the wound is there and it's not healing well, there can be what we call the gangrene. So gangrene just means that blood flow to the legs is impaired, so you don't have enough blood flow. Even if you are taking medication to treat the wound, because the blood itself is impaired, the blood flow is impaired, it means that when you take the medicine orally, it's not getting to the where the wound is, so it wouldn't be able to heal well. So that is why most people...
And we can't apply the medication like externally, perhaps a balm or something.
Even if you apply it externally, it has to go inside. It has to do with the blood. If there is not enough circulation within your system. You know, when you have a cut, the blood comes there, the blood that comes there helps with the healing. That helps with the healing. So if there is not enough blood supply to the sites of the wound, then it means that the healing will be impaired and it could cause some of these complications. People lose their legs and all that because of diabetes. So we need to pay particular attention when it comes to managing diabetes.
You know, it's such a broad topic, and you've given us a broad understanding of what diabetes is and everything. And now that we are coming to the end of the conversation, give us a ray of hope for people who have it, for those who don't, perhaps how we can change our lifestyles, whatever it is, before we leave the studio this morning. Give us that ray of hope.
Yeah, we've said a lot. I know today some people may be scared, but it's not to put fear in us. The goal of everything is to make sure that we detect it early. And when we detect it and we are put on any medication, we need to comply with the medications. Diabetes is a chronic condition. It needs to be managed. So we can manage it to the extent that your body will be able to control it. But you don't necessarily have to go off it completely. Even if it's within the normal range, you need to be checking to make sure that it's within the normal ranges. You need to visit the hospital from time to time to make sure that there is no end organ damage and all these things. And the medications that we give actually works. They are herbal options, they are orthodox options. Depending on the option that you need, the best thing is to go to the right facility to get the right diagnosis, so that if there is any complications, we will be able to pick it up. Some of these conditions is the complications that could rather affect you. So we need to make sure that we don't go into the complicated issues. So when we detect it early, we should comply with the medications and all that, and we'll be good to go. Lifestyle also play a major role. Once you are taking the medications, you need to reduce certain things. Diabetes is a lifestyle thing, so you need to comply with the advice that you are given, the food that you have to take, the time intervals that you have to take, and also the exercises that will be prescribed for you. It goes hand in hand. If you are taking the medication, you need to have that lifestyle change, and vice versa. So you need to.
There can be no cheating. It's like, oh, one day let me just take this.
No. You have to comply with it. Sometimes some people start with so many medications. When they are coming for reviews and we see that it's going down, we reduce some of the medication. There are people that we've been able to reduce the medication to the extent that they take just one medication in a day and they are good to go. So you need to monitor it. If you are not monitoring it or you are not managing it that is when we have to pack so much medicines for you to be taking and all that.
And I'm sure that's not pleasant.
No, not at all.
We don't want that. Yes. So that's Dr. Prince Osei, Medical PR of Medimoses Clinic and Prostate Center, taking us through the conversation, living with diabetes, managing the conversation. We've said a number of things, but there is a ray of hope, and they can manage the condition. That way, it doesn't lead to further complications for your life. Thank you so much, Dr. Prince, this morning. And just before I leave the studio this morning, there are some quick birthday dedications to two of our very own, David and Mercy. So happy birthday to you, David. This one says, wishing you a new age of God's blessings, favor, glory, life, wisdom, and love. Happy birthday, David Enchil Abam, from your birth date partner. And this one says, happy birthday, Madam Mercy Wellington. May you walk in the spirit of unusual wisdom and excellence, and may God jealously preserve and protect you and lighten your path. And this is from all the crew members of VFS and technical